This show is for educational and informational purposes only. It is not to be used for diagnosis, evaluation, prevention, or treatment, which requires your medical team.
Hygiene is basic for people with diabetes. The importance of hygiene is to prevent foot problems, which are more common to the diabetic than they are to the non-diabetic. As the disease progresses and complications add up, the need for proper care increases. So every day, keep your feet clean. Use a mild soap and no bubble baths. They are just too dry.
Rinse the germs down the drain. Also, rinsing the soap away minimizes skin irritations. The problem with regular foot washing is it can dry out the skin, and we want to prevent that.
Dry skin can be common in diabetes and aging. Dry skin depends on its water content and the holding of that water. Dry skin prevention is important in decreasing the risk of ulcers. Soap and hot water can remove oils that are barriers to water loss in the skin. Soaps and skin cleansers are important to the daily care of the diabetic foot. Do not use strong or harsh soaps on your feet. Do not use perfume soaps.
Here we see pictured 3 hygiene products: Dove for sensitive skin, Basis soap, and Cetaphil cleansing bar. Dove and Basis, I think, are soaps, where Cetaphil is a skin cleanser. These 3 I have used and seem to work very well for dry skin. Again, the recommendation is to use a mild soap without perfumes. Unless you have dry skin, then consider a soap with a moisturizer. CeraVe Dry Skin Relief Cleansing Wash is the most moisturizing product I have found for my skin. Diabetic Defense Daily Therapy Foot Wash. I didn't know what to expect when I tried this product, but I tried it, and my foot felt, well, reinvigorated. I was surprised at how well my feet felt after this foot wash.
Hot water can strip the moisture and essential oils from your skin.
So don't use hot water, use warm water, and don't use long showers. Long showers, like hot water, can strip the skin of its oils.
Do not soak your feet because your skin will get dry. You do not want to soak your feet because they can leave your skin dry, scaly, and parched, which makes them more likely to tear and crack.
And be careful not to use vinegar or Epsom salt soap. Remember to always follow your doctor's advice on soaking. He may want you to soak your feet for a special purpose. Follow your doctor's directions.
Before bathing or showering, test water to make sure it is not too hot. You can burn yourself easily if you don't have feeling in your feet. So test your water.
You can use a thermometer to test the water. 90 degrees Fahrenheit to 95 degrees Fahrenheit is safe.
Use your elbow to test the water to see how hot it is. You can use your wrist unless you have neuropathy in your hands. So test the water, but not with your feet. If you don't know how warm the water should be, test it with a thermometer and then test it with your elbow or wrist and check it against the thermometer to see if it's in the right range. The water that runs off your body while showering doesn't count as washing your feet. And of course, avoid long hot showers. Wash around the nails, the end of the nails, and between and under the toes. Washing lowers the bud count. Lathering up your feet helps lift dirt, grease, and germs from the skin and washes them down the drain.
Foot washing technique suggestion. Wet your feet by rinsing your feet with clean, warm, not hot water. Apply cleanser and lather your feet. Lather tops, bottoms, sides, front, back, and between and under the toes and at the end of your nails. Gently lather by massaging in circles around your foot in all areas for at least 20 seconds. Rinse your feet well with clean water and pat dry your feet using a clean towel. Here are some items that may help you washing your feet. A bath bench so you can reach down and wash your feet, bath mats inside and outside the tub, and a shower head that has a hose on it so that you can spray your feet. Grab bars may be helpful also.
If you have bending problems, there are foot care products such as the foot care brush and sponge that can help you clean your feet.
Skin against skin locks in moisture and is a breeding ground for germs. Between your toes and the underside of your toes locks in moisture and is a breeding ground for the fungus that causes athlete's foot. Pat dry your feet. Avoid rubbing the skin.
Dry areas where water can hide, such as between the toes and under the toes and at the top of the toes. Water that gets trapped and hidden can be an environment good for germs to breed. I had trouble drying between my toes with my bath towel because it'd get moist when I dried off my body, and then that big old towel was hard to put between my little toes. So I started thinking, what can I use? Maybe paper towels? Well, that would get expensive and they were kind of rough on my feet. So then I thought, what's soft and absorbent? And that's your sock. So you can take a sock and dry between your toes and under your toes with it and at the base of the top of your toes. Remember that the sock drying is not sock flossing, where you rub back and forth like a piece of dental floss between your toes. That's too rough. Pat dry. Pat dry.
You want to keep the skin between your toes dry to prevent infections. You might want to ask your doctor what kind of powder to use to keep your toes dry, or how to do it. Use a moisturizer within 3 minutes after washing your feet. There are many moisturizers and we'll talk about them in a later lecture. Do not moisturize between the toes. And remember, we are friends in the fight for feet. This is the Diabetic Foot with Dr. Joe. If you have any foot washing technique tips, put them in the comment section below.